At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
MedsPLUS is there for any and everyone who wants a special touch with their pharmacy needs.
Call or visit today for a free consultation.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.
Hello, everyone. Yes, today is Monday, and welcome to MedsPLUS Medical Minute. I am Dr. Jennifer, and I am coming to you live from our office, downtown Birmingham, MedsPLUS Consulting. But Dr. Pauline, as you can see, she is in a vehicle. Dr. Pauline, tell the people
That's
where you
right.
are.
Yes, I am not in Birmingham. I'm actually in Montgomery. So many of you know that I have a high school senior. My daughter is a high school senior, so we're actually on our first college tour today. So I'm in Montgomery, Alabama.
Exciting, exciting. So we pray for you all to have a wonderful trip down. And it does culminate with the football game today. Is that right?
Not this one. So we'll actually be visiting, we're at Alabama State today. We'll be visiting South Alabama in a couple of weeks, and that one will culminate with the football game.
Awesome, awesome. Well, glad that you could join us today.
I wouldn't miss it. This is my favorite time of the week.
Yes, yes. Well, hello, everyone. I want to talk to you today about something that has come back onto the forefront, and it's very important. And we wanted to talk with you about COVID or the coronavirus. Yes, we're not seeing the numbers we did during the height of the pandemic, but COVID has not disappeared. And as we move through different seasons, it's something we need to stay aware of. Here is what we know. COVID continues to spread, but most people now experience milder symptoms. And those symptoms can be similar to the cold, flu, or sinusitis. But for those with chronic conditions or people over 70 or 60, older adults, or those with weakened immune systems, it can still cause very severe illness. The good news is we have some tools that are available by way of the vaccine, and Dr. Pauline is going to talk to us about the vaccines.
Yes, so the vaccines were actually recently approved. They've been rolling out over the past few weeks, and we're excited to say that the vaccines are here and they are available. What's a little bit different this year, though, is the vaccines were not approved to be for use for everyone. And I think that's important. Right now, the FDA has approved the vaccines for if you're 65 or older. Anyone 65 or older can receive the updated or the 25-26 COVID-19 vaccines. So that's anyone 65 or older. If you are between the ages of 12 to 64, they're recommending that you talk to your doctor, and you have to have some type of condition that puts you at risk for severe disease. So it may be respiratory, it may be a disease or medication that you take that makes you immune compromised. All of those are important to talk to your doctor and figure out whether the COVID vaccine this year is appropriate for you. I know this causes a lot of confusion, and we want to be here to serve as a resource for you. So definitely reach out to us if you have any questions about whether you are eligible. We do know in some cases that accessibility is being an issue, where you may go to the pharmacy and the pharmacy may be out of the COVID-19 vaccine, or you may go to your doctor's office and they're not carrying it or they don't have it in stock. So definitely keep in touch with us, and we'll try to keep you abreast on everything that's going on with the vaccine availability.
So the dominant strain that's out now is the XFG, otherwise known as Stratus variant. So far, it behaves as the Omicron variant in the past. It's highly is highly contagious, but it's also manageable. So one of the things that we have in our toolkit when we do become sick or we have symptoms that resemble a cold or flu and or sinusitis is that we still have testing available. The testing that is available, the nose, where we use the nasal swab, it can be quite uncomfortable. So if they're trying to distinguish between the cold, or if you have flu, or if you have COVID, now they have the combined test where we can test for COVID and influenza A, influenza B. So that is one of the things that MedsPLUS does have. We do have one of the combination tests. So if you do have symptoms, it is wise or recommended to do a nasal swab test to test to see if you test positive for COVID. It's always good to get 2 tests at one time because you want to be able to test initially to see if you have COVID and then 72 hours test again to see whether or not you're positive. And then also if you test positive initially to test a second time to see if you are no longer positive. So we do have the test kits here at MedsPLUS to test for not only just COVID, but for COVID and flu with just one nasal swab test.
And I think too, we need to kind of discuss the prevention. So during the pandemic, a lot of us took prevention measures such as wearing masks. We finally got to the point where people were washing their hands on a regular basis, and things like flu and other respiratory diseases were on the decline because we were actually taking mitigation measures. So I think it's important to make sure that all of those mitigation measures still work. So you definitely want to, if you'd like to wear a mask in public, I was at an event recently where there were a lot of people in a small room and there were people that had on masks. Of course, if you use the restroom or you're in a situation where you're shaking a lot of hands or, in church and we want to hug each other, make sure that you have the portable hand sprays and sanitizers and things like that. All of those mitigation measures still work, and it will allow us to be able to go through this COVID period and through this respiratory virus season without infecting everyone around us.
Very, very
So
great.
Jennifer, have you noticed wearing masks and doing things like that? Have you noticed any of that?
Yes, as you know, we're out in the community doing the vaccine clinics. The last place we were, pretty much everybody had on a mask except me, which I need to change that standard as well, and I shall, because once you start to get around more people like that, and it is this time of year, we need to be cautious versus playing defense. So we need to play offense versus defense. So I will be pulling my mask back out, particularly when we're at the flu clinics and we're up close and personal with everyone. So we want to be mindful of that, because I had one person ask, well, why don't you have on a mask? And I didn't really have a good reason other than I just didn't have it on. So I'm going to readopt what we should be doing and what we're practicing and what we're preaching right now, because it is that time. And I mentioned the sinus piece because I've been having that issue as well with the headaches, the stuffiness, the phlegm. And although I'm going through my regular allergy routine, it does not seem to be as effective. So we need to keep that in mind as well, that we stay in touch with our treatments and we're doing them regularly, and or going in to see the doctor and or getting a test if we deem that necessary as well.
And I think that's a good point to bring up too. As pharmacists, we all the time make recommendations to people on how to stay healthy, particularly during respiratory virus season. And we know that back during the pandemic, there were just multiple supplement regimens that people use to stay healthy. High levels of zinc. People were taking vitamin C out of the wazoo. turmeric and all other type of supplements that people took. Do you still like those are do you still feel like those are effective now? Like if you stop those, should you begin taking those vitamins and supplements again to kind of boost your immune system?
Actually, I do. I definitely think we need to always remember during this time to keep our immune system boosted. Why is that? Because of stress. Stress weakens our immune system. And this just over the past 4 or 5 days, we've just been in stressful situations, especially if we listen to the news. And that's kind of what I talked to the team about this morning, and being able to talk about it, to, of course, in a safe space, to express it, to get to a reckoning or a resolve within yourself and your own opinion of things that have happened. And you're entitled to your opinion, but the more we bottle those things up or we avoid them, stress can start to settle in, and we not even be aware until we've become sick or ill or something happens out of the ordinary. So I definitely do agree with making sure your supplementation regimen is correct. I am careful of throwing out 2 or 3 supplements to take because I like to work the patient up to make sure that we're not overdoing it or recommending something that may not be useful for them. So that's where MedsPLUS comes into play. And we want you to be able to reach out if you have questions about that so that it can be tailored and individualized to you. So as healthcare professionals, we have to be careful with the information we give out and make sure that it is unique for you and the person that we're speaking to. One last thing we'll talk about, and Pauline will close us out, is treatment. So there is treatment if you do test positive for COVID. It is a prescription that would be required by your physician, healthcare professional. And that antiviral is Paxlovid. And that supportive care, along with the prescription, definitely helps to reduce the time that you suffer with the symptoms with the Paxlovid. It's definitely recommended if you have another health condition to have the treatment versus just trying to fight it alone or wait until it progresses and then go to the emergency room or try to go to the doctor. So it's best if you have the symptoms, you test positive, to get that seen by the physician to get you on a medication regimen. So high-risk patients seek testing early. And for the treatment, the Paxlovid, it works best within 3 to 5 days of symptom onset. So the sooner, the better for the treatment if you do test positive for COVID.
Absolutely. So we've just got a comment. Great information. Thank you very much. We definitely aim to provide relevant, timely information that will hopefully help you all make great healthcare decisions. So just want to follow up with some things today. It is respiratory virus season. We are seeing an increase in COVID positive cases. Soon as the weather gets cooler, people start migrating indoors. We will probably see a rise in flu cases. So Dr. Jennifer mentioned you want to have your test kits on hand. Now available at our pharmacies and other pharmacies. You have the combined COVID, flu A, flu B test kit. So you can get that, have 1 or 2 at your home so that if you or someone you know starts feeling ill, you can get that test done immediately without having to necessarily go into an urgent care center or your primary care provider. So you want to be prepared with that. You want to be prepared with your supplementation. So if you don't have a supplement regimen, we are here to walk you through that process. You can call our pharmacy, speak with our pharmacist, and be able to have a regimen that works for you that will hopefully just boost your immune system so that you can get through these. And the other thing is treatment. So if you are at risk for severe disease, you want to make sure that you notify your doctor immediately that you tested positive for COVID and that you would like to begin treatment for the virus. Those are 3 main points we want you to get out of this conversation. And how can I forget this? As the vaccine queens, we want to ensure that you are vaccinated. So if you're 65 or older, reach out to us to ensure that you get your COVID-19 vaccine. We'll be in the community over the next several weeks with vaccine clinics. So definitely pay attention to our page so you can figure out where we'll be and when you can get your vaccines. And also it's important now to get your flu vaccine to ensure that you're protected for this year's flu season. As always, if you have any questions, feel free to reach out to us at 205-650-4636, or you can visit our website, MedsPLUS, that's MEDSPLUS, consulting.com. Coming live and direct from Montgomery, I'm Dr. Pauline. You've seen Dr. Jennifer, and we'll see y'all next week for MedsPLUS Medical Minute Live. Bye, everybody.
Bye.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Don't settle for less when it comes to your health. Empower your health journey with a pharmacy that puts you first. Transferring your pharmacy is easy with our guidance. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.